So thank you very much to the organizers of the webinar for today. And I would like to first acknowledge the people who contributed to this presentation, Oyama Chona and Noketo Mhlanga, who are also on the audience today. So we've been asked to talk about COVID-19 pandemic and gender-based violence in Africa. In the interest of time, I will not go through the presentation outline, but I will shoot straight to reminding us what do we talk about when we talk about gender-based violence and violence against women. In particular, our area of interest in the field of gender-based violence is violence against women. Whilst I will not define violence against women because I assume that we can all see the definition, I would like to highlight three things about this definition. The first thing is that in this definition, the perpetrator is not mentioned. And whilst the perpetrator is not mentioned, we do know that perpetrators of gender-based violence against women are mainly cisgender heterosexual men. I think it's very important that we keep that in mind throughout our work. And I think I also want to mention that the target for gender-based violence against women is also not mentioned. And whilst it is not mentioned, we know that the target for gender-based violence against women is all women in their diversity. And whilst it is all women in their diversity, we don't know how much of this problem affects women who are lesbian, bisexual, intersex, transgender, queer or non-conforming in any other way, because there is an assumption that the definition of violence against women includes these women, but we know in our context that it does not always cover women in their diversity. A progressive stance in this definition is that the definition highlights the consequences of the acts that are perpetrated against women rather than the action or the intentions of the perpetrator. So it is in fact survivor or victim-centered, and it focuses on the consequences for the woman, which is really very important for the work that we do. I also reflected on the Maputo Protocol, Article 1, Paragraph K, which also includes girls when it defines gender-based violence or violence against women. And so we have then included aspects of child sexual violence, which is Noketo Mhlanga's area of research. And in this presentation, a child sexual violation refers to an act which is forced upon a child, and it is for the gratification of the perpetrator. It may include sexual acts, production or exposure to pornographic material, or also statutory rape. Once we recognize that, again, this varies across contexts in the African continent because national laws are not the same. In the South African context, for example, statutory rape is an act, sexual act with an individual below the age of 16. So if a boy is over the age of 16, they may not have sex with a 12-year, 13 or 14-year-old. Otherwise, that would constitute rape in this context. So it's very important that we think about the different contexts. So what do we know and how do we know what we know? This is very important for us as researchers because there are two sources of data for gender-based violence against women. It's routinely collected service data, also data from research studies. And when we talk about routinely collected service data, this is data that mainly comes from police records, from healthcare services, from social services. It is data that comes from domestic violence call centers, gender-based violence, civil society services. And when it comes from research studies, it's usually surveys, intervention research. It can be qualitative or quantitative. Now, for the focus of today, what happened during the 2020 COVID-19 lockdown? We know that globally, business as usual ceased for many as the coronavirus forced the global society into countrywide lockdowns. Public health measures were adopted to regulate the spread of the virus, and these measures restricted people's movements. So what this meant was mostly women who were at risk of gender-based violence were stuck at home with their abusive partners. Early on, at the beginning of the pandemic and the public health measures, the lockdowns in particular, there was an expectation that violence was going to be on the increase. And we saw a warning coming from UN Women that as people spend more time in close proximity in household isolation, women and children will be at greater risk of experiencing higher levels of violence. Even though this warning came early, it does not look like that we did hit the warning. I do want us, even though I've been asked to talk about GBV in the context of the continent, I would like us to also remember that the problems that are experienced in this context, in this continent, with respect to gender-based violence are not unique to this continent. This is a global phenomenon. So at the end of March, for example, Google announced that there was a hike in searches of the words domestic violence. So a lot of people were already experiencing and needing assistance with domestic violence, and there was a 75% hike in searches for the help with domestic violence. Globally, we get reports that the number of women calling domestic violence support services was reported to have risen significantly in various countries. SMSs and emails to support services also increased. And in the first days of the confinement, there was an increase in domestic violence, which was reported in many places. At the conference yesterday, there were presentations that came from other African countries that I would like us to reflect on. And we had at the conference yesterday, Vespa Shisumpa's paper from Zambia also reported an increase in gender-based violence. And as schools were also closed in Zambia, Vespa was of the opinion that this exposed young girls to gender-based violence. Akiyode Akorede's paper from Nigeria also suggested that the lockdown increased the girls' vulnerability to gender-based violence in Nigeria. In Zimbabwe, Talent Tapera's paper also reflected on the number of calls that were reported by the national GBV hotline Musasa, which recorded an increase in gender-based violence calls, where they recorded about 4,047 sexual gender-based violence calls from the 30th of March until the end of July. And Talent Tapera suggested that that was an increase of about 70%, I assume, compared to same time last year. So in South Africa, what happened? During the 2020 COVID-19 lockdown, as I've already mentioned, we also pick up this data from the police service record. And the police record reported that in the first week of the lockdown, there were more than 2,200 complaints of gender-based violence that were recorded. And according to them, this was a reduction in reported cases of domestic violence in South Africa during the lockdown compared to same time last year. However, later on, there was data that was released that suggested that, in fact, they were beginning to see an increase in the number of calls or the reports for gender-based violence. At the beginning of the lockdown, the Gender-Based Violence Command Center in South Africa suggested a surge of gender-based violence since the implementation of the national lockdown, with about 87,000 gender-based violence complaints in the first month. And this is something that they have never seen. And some people in South Africa suggested that we had seen a 500% increase in calls and requests for assistance with gender-based violence. And the increase in gender-based violence against women was confirmed by people who work on gender-based violence on the ground, in particular from NGOs. There are two groups of women that we are reflecting on in this paper. We are reflecting on women who were already victims of domestic violence against women at the time of the lockdown, and also women who were at risk but had not yet experienced any violence before the lockdown. What is interesting is that from our reading and analysis of the data, frequency of violence may have increased in homes where there was already violence that was experienced by women in those domestic spaces. But also, in addition to the frequency, there was also probably an increase in severity. And also in those instances, Where people were contemplating separation or divorce, it may have been difficult for them to act on their plans for separation and divorce because there were no strategies for them to access informal or formal sources of help. So that is one group of women. The other group of women are women who had not experienced any violence before the lockdown, but during the lockdown in their homes, probably tensions escalated and this led to new incidents of violence. So a combination of the increase in the frequency and the severity in homes that already experienced domestic violence and new incidents in homes that experienced domestic violence for the first time during the lockdown may have resulted in what we now see as reported increased violence by the National Command Center. And two things that are important that were happening is that women did not have access to informal sources because they could not travel to their friends, family, or colleagues, and they also did not have access to formal sources because other than the health services and the police, most NGO services or community-based services were closed during this time. So women were locked down at home. We know that home is a contested site for unequal power relations. The problem with our homes is that the violence that is happening in our homes is sustained through the existence of age, gender, income, and status power dynamics, and is complicated by relationships of power. What do we mean by this? Heads of households, which are usually men, are usually older than their wives. They are men, and so they already have the gender power that comes with being a man in this context where patriarchy affords men a particular power. They usually have an income or a higher income than their wives, and they also have a particular status in the society because they usually either hold better jobs that are afforded particular status. And at home, they are also trusted members of their families. They are fathers, they are grandfathers, they are brothers, they are uncles, but during the lockdown, they were all home. And in homes, there is an emphasis also on obedience and men's supremacy as the head of the household. It is at home that children are exposed to adult domestic violence, whether it is interpersonal or intimate partner violence, but children witness a lot of violence that is happening between adults at home. It is at home where sexual violations occur, whether it is incest or it is statutory rape, it happens. But also it is at home where intimate femicide incidents also occur. And we know that these are usually preceded by long periods of domestic disputes that Nahama Brody calls the time bomb in her recently published book Femicide. And we also know that children may also be victims of femicide in their homes. And these are the reasons why probably there is an involvement or an inclusion of children when we discuss violence against women, and so we discuss it as violence against women and children sometimes. So just maybe a last slide that reflects on violence against children. So sexual violence during children against children during the pandemic may have also increased because we do know that essential workers were allowed to work during the hard lockdown. However, in a context where the term essential worker refers to people who work, for example, in health services, in social services, in the hospitality, in retail, as community volunteers, we know that in our society where there are gender stereotypes about care work, these people became the essential workers, and so they were the ones who were leaving home. So they were leaving home and leaving behind their children at risk of violations from the other workers who were not allowed to work but stayed at home. So this period during which I'm going to call the care worker the mother, even if they may not necessarily be the biological mother to the children that they care for. But when they were away working as essential workers, this created a window of opportunity for children to fall victims of sexual violations from people who were in homes. And we know that perpetrators of child sexual violations include other children as well. And during this time, schools were closed. All the children were at home and were not allowed to go outside and play outside. So in some of the communities where there is close proximity, they probably had access to friends, to playmates, or to romantic partners, and they could have been victims. But also children are also victimized by adults as well, who are their relatives, family members, acquaintances, and neighbors. But these are some of the scenarios that we would like to bring to you today that may have increased the reporting of violence against women and children. I already mentioned in one of my slides earlier that there are two sources of data, is the service provision data and survey data. But given the context and the situation that we work in now, there are limitations to what we know as researchers about gender-based violence globally, not only in Africa. And these limitations are because gender-based violence generally is often surrounded by complications that impede on reporting of these cases to authorities. So people are motivated to conceal crimes such as incest, statutory rape, child marriages, forced marriages, or any other threats. So because people are motivated to conceal these, they are not always reported to the police or to the social workers or to the health services. And also in some of our contexts, there is an absence of a specific crime category. So even if as researchers we request information, for example, about what has been the prevalence of domestic violence in South Africa or in any country in the past 6 months, it may be difficult for us to know because there isn't a particular crime called hate crime, for example. So we may not know how many women were victims of hate crime, even though we know that there may have been heightened risk for lesbian, bisexual, intersex, transgender women. We may not know, for example, how many women were victims of femicide, because there isn't a specific crime category called femicide. So because it is not recorded in those ways, it requires a lot of time for the researchers to go through the data to be able to determine that this was indeed a hate crime against a lesbian, this was indeed a domestic violence crime, or this was indeed a femicide crime. And also because we rely on service data, and the regulations that restricted the movements during the pandemic further impeded on the reporting of these crimes. So the COVID-19 pandemic made it difficult to acquire comprehensive information on the extent of the prevalence of abuse, because it was difficult for people to access these services and report. We rely on media reports, at least for now. It's even difficult. We try to access this information from the government or from NGOs. They also don't have information that is coherent and is comprehensive and is collected systematically. And we know that media reporting has its own inherent biases. It is useful to some extent. And my our last word is now on online data collection. The COVID-19 created an opportunity for a lot of research to be conducted online, but we are yet to see some outcomes of online surveys on gender-based violence, because these are still at its it's still at its infancy. There has been attempts to use technology to collect information around gender-based violence, but just before the lockdown, what we had seen researchers doing was to use, for example, cell phones or tablets, but these were also administered in a face-to-face interaction and not sent as links. So it's only now that there are researchers who are starting to collect information using surveys that were sent on cell phones. Thank you.